Hi, I'm Lillian Zhang, and my project is using WET1 and SOX10 as markers for craniofacial osteosarcoma tumor cells for retainment and neurocrest stem cells.
Osteosarcoma, OS, is the most common histological form of primary bone cancer and is the third most common cancer for adolescents. There is an estimated 5 million cases for U.S. patients under the age of 20. The survival rate for primary craniofacial OS is estimated at 55%. Surgical resection can be used to remove the tumor and correlates well with survival using defined tumor margins, but in 50% of cases, tumors spread to adjacent areas, which decreases surgery success. Therefore, after reading my mentor's research grant on osteosarcoma, I realized there is an important need to better identify tumor margins to refine surgical resection and thus result in better patient outcomes. After reading many research papers, my mentor and I developed a viable research question to work on.
I am conducting research under the guidance of my mentor, Dr. Mark Hansen, in his lab at the University of Connecticut School of Medicine. Dr. Hansen and Krista, his lab assistant, taught me methods and how to operate lab equipment. After practicing, I will execute the study independently from labeling cells immunohistochemically with antibodies to microdissection. Experimentation began in mid-December and will end in late January.
The neurocrest arises at the neuroplate border of the vertebrate embryo and is a multipotent collection of cells. Preliminary research from the Hansen lab suggests that primary craniofacial OS tumor cells are highly similar to neurocrest stem cells that persist in adulthood as a group of multipotent cells.
It is highly suggested that the tumors arise in the parts of the skull that are derived from the embryonic rest of the neurocrest due to the stem cells' malignant transformations.
I hypothesized that primary craniofacial OS tumors do arise from neurocrest stem cells using laser capture microdissection of immunohistochemically labeled cells, a technique previously utilized by past studies to examine other tumors. To test the hypothesis, I will use lineage fate mapping to mark cells of neurocrest stem cells at distinct times of development.
WET1 and SOX10 are the hypothesized best markers since the two genes are still expressed after development. Two distinct immunoglobulins for WET1 and SOX10 will be used to mark cells of neurocrest origin.
A fluorescent tag will be applied to each antibody, so pseudo-colored red would represent WET1 and pseudo-colored green will represent SOX10, and the yellow color will identify that both genes are present. The groups tested will be 8.5-day embryos, 10.5-day embryos, 16.5-day embryos, in addition to human bone tumors. Sliced tumors are viewed under a fluorescent microscope for microdissection, and statistical analysis will be completed using graph prism. Thank you for your consideration of my project in CT JSHS.